Good morning. Today is Friday, April 9th. I am very pleased to be here, of course, with Dr. Janae Caldoun, our Chief Medical Executive, and Tina Fries-Decker, the President and CEO of Spectrum Health in Grand Rapids. So, good morning. Today we're going to discuss Michigan's ongoing vaccination efforts and address the recent rise in cases. Michigan has administered over 5.1 million doses of the safe, effective COVID-19 vaccines to over 3.1 million Michiganders. That's 5 million doses in less than 4 months to nearly 40% of our state. And we're speeding up. We went from 4 to 5 million doses in under 2 weeks. On Tuesday, my older daughter and I were proud to add 2 to that number when we got vaccinated at Ford Field by Michigan's Chief Medical Executive, Dr. Janae Caldoun. I also want to acknowledge some members of the legislature who've gotten vaccinated recently, like Representative Graham Filler, Representative Christine Morse, Senator Eric Nesbitt, and Representative Felicia Brabeck for leading by example and getting their first shots recently as well. Those are legislators from both sides of the aisle, and I think that's important for us to know we're all in this together. Almost 175 million doses of the safe, effective COVID vaccines have been administered across America, which is smashing President Biden's goal of 100 million shots in 100 days. Over 1 in 3 Americans have received their first shots, including 77% of seniors and over 80% of teachers nationally. All Michiganders 16 and up are now eligible to get vaccinated. The vaccine is the most effective way to protect you and your family from this virus. And getting vaccinated is the quickest way for our lives to return to normal. I urge you to get your shot at a local pharmacy, a drive-through location, a mobile clinic, or at one of our community sites like Ford Field or the one at DeVos Place in Grand Rapids. There is light at the end of this tunnel, but the recent rise in cases is a reminder that we are still in the tunnel. The only way out is forward and together. We have all the tools we need. We know what works. We must mask up, socially distance, wash our hands, stay home when we're sick, and most importantly, get vaccinated as soon as possible. Our effective vaccine response is a testament to what we can do if we work together. Getting vaccinated and staying out of the hospital is a good way to thank our healthcare workers, our medical professionals, and hospital staff for their incredible sacrifices and service over the past year. We should also recognize the frontline workers who have all gone above and beyond to keep the rest of us going, and the scientists and researchers who designed, tested, and manufactured these 3 vaccines, miracles of modern science. I know Michiganders have made extraordinary sacrifices over the past year, and I want to get back to normal as much as everyone else. I'm tired of this, but we've got more work to do. We could get through this quicker and stronger if we got a little more help, too. We've administered first doses to 3 million Michiganders and repeatedly hit our new target of 100,000 shots a day, which is great progress. But the variants in Michigan that we are facing right now won't be contained if we don't ramp up vaccinations as soon as possible. We need additional supply of the one-shot J&J vaccine, which we believe is vital to our strategy of rapidly distributing vaccines and slowing the rise of spread. From public health research, we know that the one-shot vaccine is critical to protect younger Michiganders or those who may have difficulty getting back for a second shot. We've been speaking with the administration in Washington, D.C. regularly over the last few days and will continue to do so, because anyone who looks at a COVID map knows Michigan is unquestionably a national hotspot right now. My team and I have been in regular conversation with the National COVID Response Team, and we have asked for more vaccines. I'm grateful for what they have offered: therapeutics, additional personnel, mobile testing, and vaccination units. But I am concerned because I believe, as do a number of public health experts, that we really should be surging vaccines to states that are experiencing serious outbreaks. A bipartisan letter from Congresswoman Dingell and Congressman Upton also echoed our call for more tests, more supplies, and more boots on the ground to slow the spread and save lives. So look, we've been doing this for a year. We have all learned to surge PPE, tests, and vaccines where there is greatest need. And just as we, the state of Michigan, stepped up to prioritize areas of our state or even assist other states in need when there was a crisis, whether it was a need for PPE or ventilators or firefighters or National Guard or masks, we stepped up and helped our fellow states. So I'm urging the federal government to create a vaccination surge program to help states like Michigan now. Because it's Michigan and the Midwest today, and tomorrow or next week it could be the Northeast or the South or another part of our country. President Biden is someone for whom I have a great deal of respect and personal affinity. He's my friend, and he is doing an amazing job responding to this pandemic. A year ago, I took a lot of heat for speaking bluntly about the lack of a national strategy. The Biden administration does have a strategy, and by and large, it is working. As should be expected, though, in an undertaking of this magnitude, there are shortcomings and different points of view. I appreciate President Biden's confident, competent leadership, and we are grateful to the administration for rapidly increasing vaccination supply nationwide. But we are still in this pandemic and continue to have conversations with public health experts. Recently, I spoke to Drs. Ashish Jha, Dr. Scott Gottlieb, Dr. Zeke Emanuel, and Dr. Josh Sharfstein. We talk every couple of months to check in. And these talks are a part of our regular conversation so that we can have all the information as we make decisions here in Michigan. These experts noted that our recent rise in cases is a compliance, variance, and mobility issue. We know enough about COVID-19 after a year of living with it that we know what works and what we have to do to reduce cases. We know that policy changes alone won't reduce the spread. So right now I want to speak to every Michigander directly. I want to emphasize we still have public health rules in place to save lives. Although we've announced some re-engagements over the last few months, we still have a mask mandate. There are still limits on indoor social gatherings larger than 25 people. We have mandatory testing requirements for sports. We're making testing easier for spring break travelers with 56 pop-up sites statewide as a part of a special testing program. We're also hosting a webinar tomorrow for folks who want to host a pop-up clinic. But as we take a hard look at the data and observe the spread of the variants, we all need to go above and beyond the rules we already have in place. We all have to step up our game for the next 2 weeks to bring down rising cases. And that's why I'm calling on high schools to voluntarily go remote for 2 weeks past spring break. Calling on youth sports to voluntarily suspend games and practices for 2 weeks. And I'm strongly encouraging all Michiganders to avoid dining indoors and avoid gathering with friends indoors for 2 weeks. Support your local restaurants by eating outside or getting carry-out instead of dining indoors. Opt for small outdoor gatherings with masks. To be very clear, these are not orders, mandates, or requirements. A year in, we all know what works, and this has to be a team effort. We have to do this together. Lives depend on it. We have to fight back against COVID-19 variants. We have to get vaccinated to keep you and your family safe. We're going to have some tough weeks ahead. So I'm asking everyone, please, take this seriously. This is my ask to you, the people of Michigan. Please redouble your efforts on these fronts for the next couple weeks. I know Michiganders are concerned about the latest rise in cases, and I am too. We've come so far. We've sacrificed so much. This has changed every aspect of our lives for over a year. We can't let up now, not when we're so close. However you want to think about it. Bases loaded, bottom of the ninth. Second overtime, shot clock running out. Fourth down on the 2-yard line with 5 seconds left in the fourth quarter. We cannot afford to strike out, miss the shot, or fumble the ball now. It's everybody against COVID, and we have to keep going until we win. That's the nature of this virus. The second we let our guard down, it comes roaring back. Luckily, we can put it behind us once and for all if we get vaccinated. But we can't get complacent in the meantime. The best way to bring cases down is for every one of us to do our part. So even if you've been vaccinated, keep masking up. The numbers show young people are not impervious to this virus, as we've seen a lot of cases among teens and young adult Michiganders. To bring cases down, every Michigander has a personal responsibility to mask up, wash their hands, and socially distance to slow the spread. We got to get enough folks vaccinated to put this behind us. I know it's been a long, difficult year, but let's just take a moment to appreciate how close we are. Think back to last spring when our primary concern was just getting our hands on PPE. Think about last fall when we had no idea how far away vaccines were, and medical experts said we would be lucky to get one in the next few years that was 50 to 60% effective. Think of the optimism we feel today. The number of safe and effective vaccines. 3.1 million Michiganders have been vaccinated and over 100,000 doses administered every day. I urge all eligible Michiganders to get vaccinated as soon as possible because it's the most effective way to protect you and your family and get back to normal. So to find a vaccination provider in your area and to schedule your appointment online, please go to michigan.gov/COVID vaccine to sign up as soon as possible. From personal experience, I can tell you that it feels great to have gotten my first shot, and I'm eager to get the benefits of the second one in 3 weeks. The 15-minute post-vaccine waiting area is one of the most optimistic places in the country right now. People are making plans to see friends and family with big smiles under their masks. You can see it in their eyes. There are sighs of relief, tears of relief, sounds of gratitude, people making happy calls and sending joyful texts and posts. On Tuesday, I was happy to join those celebrations. I can't wait to be with my friends and family this year, and I know we can beat this together. An incredible summer, our Independence Day, normal life, these are all within reach. The path is clear. But we got to double down on our efforts now to slow the spread and get vaccinated. We have to hang on a bit longer. I know we can. So let's get it done, Michigan. Thank you, and with that, I'll turn it over to Dr. J.
Thank you, Governor. So as the governor mentioned, I am quite concerned with what we are seeing in our data. We are on track to potentially see a surge in cases that's even greater than the one we saw in the fall. We are now at 515 cases per million people. That's 4 times where we were in the middle of February. The percent of tests that are positive has now increased to 18%, also 4 times where we were in the middle of February. We have not seen that high of a positivity rate since our first surge last spring, a year ago. And that's concerning because we are doing many more tests than we were then. And this indicates that there is now broad community spread. Hospitalizations are also increasing. 15.2% of hospital beds across the state are now being used to take care of patients who have COVID-19. And we now know that hospitals are evaluating and implementing their surge plans, including consideration of canceling elective surgeries that are not time sensitive and preparing to make sure they have the equipment, supplies, and staff to be able to take care of both COVID and non-COVID patients. MDHHS is also tracking 991 outbreaks in counties all across the state. That includes new outbreaks in K-12 schools, manufacturing and construction, long-term care, child care, retail, restaurants, and bars. Between January and March, we saw 291 outbreaks associated with youth sports teams, both contact and non-contact sports, that involved at least 1,091 people. We have seen 58 new outbreaks in just restaurant and retail settings alone in the past week compared to the previous week. We also know there's general community spread of the virus. This includes the spread of these more easily transmitted variants. Our lab has identified 2,262 of these variant cases in 60 counties across the state, and there are likely many more that we don't even know about. And because we are seeing so many cases a day, our public health system is overwhelmed. We are not able to get information on many cases, nor are we able to identify their close contacts. We don't know where all the cases or outbreaks are, and what we do know is likely an undercount. So these trends are concerning. We need everyone to do their part, not only to protect themselves. Think about the person who may have an underlying medical condition or who is older and is more likely to die from COVID-19. Think about the person who may need to have a surgery or seek emergency care, and the staff or beds may not be available in the hospital. This is serious. We are all connected and we're in this together. And now is the time for us all to heed these warnings and do our part. So the data is concerning, but there is no need to panic. We know how to do this. And I want to be clear, and I've said this before, just because something is open, it does not mean that it is safe or that you should do it. Given where we are with our numbers, MDHHS recommends that all high schools pause in-person learning for 2 weeks. Students and staff should also get tested if they have traveled during that time. As the governor mentioned, we have over 56 pop-up testing sites with schools on campuses across the state that are offering post-spring break testing. We also recommend that all youth sports, both contact and non-contact, pause both practice and competitions for 2 weeks. Everyone should also be implementing specific public health mitigation measures in their personal lives. Infectious disease and public health experts across the country have been quite clear that indoor dining is one of the riskiest things you can do during this pandemic. And with the numbers that we are seeing now, we simply do not recommend it. You should order takeout or drive-through service or do outdoor dining. My family orders takeout multiple times a week. You should avoid gatherings with multiple households. And if you do have a gathering, it should be small, it should be outside, and people should be wearing a mask. And you should get tested. If you've been exposed, especially if you just returned from a spring break trip, get tested. We've worked with local partners to set up testing sites at some state welcome centers and airports even to make sure it's easy for you to check, get tested, and make sure you don't bring COVID home. You can also and should download the My COVID Alert app so that you are alerted if you come in close contact with someone who has COVID-19. It's free and it's confidential, and it's even more important now because our public health system is overwhelmed and cannot keep up the pace with all of our new cases that are coming in every day. So these are very tough things to do, and we do not make these recommendations lightly. But everyone needs to understand that if we can just pause some of these activities temporarily, it will go a long way to prevent the spread of the virus and to save lives. These measures work. We also know that vaccines, of course, are the most important tool we have to prevent the spread of COVID. Everyone in the state over the age of 16 is now eligible to receive one of these safe and effective vaccines. And I want to be clear, these vaccines have been studied in tens of thousands of people. We now have data from almost 175 million doses that have been put into the arms of Americans over the past 4 months. The science is very clear. These vaccines work, they are effective, and known potential side effects like a sore arm or maybe a mild fever or body aches, that's to be expected, and it means that the vaccine is working. We have the capacity in the state to do over 100,000 shots per day. And I'm thrilled that we now, today, will reach an incredible milestone of 5 million doses in arms. Vaccines are simply the best tools that we have to slow infections and be able to return to a greater sense of normalcy. There are also things that you can do after you've been fully vaccinated, meaning 2 weeks after your final dose of your vaccine. You don't have to quarantine if you've been fully vaccinated and don't have any symptoms. You can travel around the country without getting a test. And you can have gatherings with other fully vaccinated people outside of your household without a mask. So vaccines not only drive down our cases, but they change the things that you are able to do in your everyday life. So if you haven't scheduled your appointment yet, please visit our website at michigan.gov/COVID vaccine for a link to your local health department and suggestions about other places where vaccines are available. And if you don't have reliable internet or you need help, you can still call 211 to be connected to the state's COVID-19 hotline. But until then, we all have the power to protect ourselves and our loved ones by wearing a mask over your nose and your mouth whenever you'll be around someone outside of your household. Keep your distance, avoid gatherings, and get tested. We are all tired of this virus and changing the way we have to do things every day, but please do not give up. We are just so close. So thank you, and with that, I will turn it over to Tina Friesdecker, CEO of Spectrum Health.
Thank you, Dr. J. and Governor Whitmer. In healthcare, we like to focus on hope and healing. And we have so much hope right now because we know that a better normal is ahead for all of us. Today, we're celebrating a new milestone of 5 million vaccines across Michigan. This is clearly a sign of hope for our future. In West Michigan, like other parts of our state, we have a collaborative that is working so hard to get vaccine to people as quickly and conveniently as possible. We recently celebrated a day where we gave more than 12,500 doses in one 12-hour clinic. I am incredibly proud of our team at Spectrum Health, as well as the teams at all the hospitals, physician practices, health departments, and pharmacies across our state who are involved in caring for our communities and distributing the vaccine. I'm grateful for the physicians and the nurses and other team members that day after day are caring for people with COVID-19 after this very long year. And I'm also incredibly proud of our communities. You have stood with us, walked alongside us, and you have heeded our messages to make sure we're practicing those safety precautions for COVID-19. And so now we need your help again. At present, we're seeing a concerning increase in COVID-19 positivity and the hospitalizations. This virus, like was said earlier, is widespread in our communities. At Spectrum Health, the number of cases, the number of patients within our hospitals has doubled over the last 2 weeks, and it continues to climb each day. For Spectrum Health, our positivity rate is now over 16%, very consistent with the rest of the state. And the new B117 variant is likely contributing to this surge, which wasn't present last fall. B117 is now the dominant strain nationwide, and Michigan has the most recorded cases. It is at least 50 to 75% more contagious than previous circulating strains. And it has the propensity to spread faster and cause larger outbreaks, particularly among unvaccinated persons when mask wearing and social distancing isn't followed. It also has a higher propensity to be spread by children, in contrast to previous circulating strains. Fortunately, all 3 available and authorized vaccines provide excellent protection against infection by B117, which reinforces why getting your vaccine is so essential. So we need to treat this time, this surge, seriously. I have 2 important messages for you today, and they were reinforced by our nurses and physicians who I talked to this week. The first is prevention. We cannot give up this fight. Prevention is critical to reduce this spread and to protect our community. I realize that we're all very tired of this, but it is just critical that we follow the best practices. Wear a mask, wash your hands often, and keep your distance. And then the second important message is get your vaccine. It is our hope for a brighter future. Getting vaccinated is another important step to take care of yourself, your family, and our community. In the latest surge, we are seeing the benefits of the vaccine. In fact, the people showing up in our hospitals are much younger than in the fall surge, and that shows that the vaccine is working. As was said earlier, there are multiple ways to get that vaccine, and our hospitals, health departments, community partners, and pharmacies are all ready to make sure that you can get that vaccine. So we need to keep prevention top of mind until everyone has an opportunity to access this vaccine. I realize this is hard. It takes endurance, it takes patience and vigilance to reach that 70+% herd immunity. But as I rounded with our nurses and physicians this morning, the two things they said today was wear a mask and get vaccinated. So on behalf of them who've worked so hard this year, please take that advice. Wear your mask, wash your hands, avoid large gatherings, and get your vaccine. I'm hopeful that this will be our last surge. So please join with us to practice these preventions to make sure that it is our last surge and we have a healthy Michigan. Thank you. Governor Whitmer.
Thank you, Sita. That was great. Great. So I'm here with Dr. J and Tina. We are happy to take some questions. And as promised, I think I will start with Emily Lawler.
Governor, sorry about that mute button. Just wondering why recommend the pause instead of require it for high schools and youth sports?
Well, let me start with this. This pandemic has been hard on every single one of us. We're all tired of this. And the actions that we've taken throughout the course of the pandemic have saved lives, and especially in the face of a novel virus, which we didn't know much about a year ago, especially in the face of a second surge where we didn't even have vaccines on the horizon. We know now that we've got the tools we need to protect ourselves, and it is less of a policy problem that we have and more of a compliance and variance issue that we are confronting as a state. Policy change alone won't change the tide. We need everyone to step up and to take personal responsibility here. So I'm not taking any options off the table, but in this moment, we are strongly urging that public schools and youth sports voluntarily take action. We are strongly urging restaurants and diners to be smart and eat outdoors or get takeout. We know what works. As Ms. Fries-Decker just said, we know what works, and we all need to double down our efforts toward making sure we push down the spread of this virus. These variants are incredibly serious and easy to catch. Because we kept our positivity rates low for a long period of time, now that the variants are here and people are fatigued, we're more vulnerable because we've got large reservoirs of people in our state who have not caught the virus yet. And that's precisely part of the issue that we're confronting, and that's why it's not about a policy change. It is about behavior change, and we need everyone to be a part of that.
Over to Dave Boucher with the Detroit Free Press next.
Hi, Governor. Thank you for taking the time. Two really quick questions. One, if this is a compliance problem, why do you think anybody will comply with your recommendations now? And two, in the fall, you said your relationship with then candidate Joe Biden would help the state in its fight against COVID-19, and yet now it sounds like the Biden administration isn't surging J&J vaccines to states like Michigan. Why do you think that is?
So first, I think people are tired. They think that because vaccines are here that we can start to drop our guard. I know that people are traveling. Snowbirds are coming back to Michigan. People have been traveling for spring break. All of these things are contributing to the spread of these variants. And these variants are just much more contagious. As I said, we've got reservoirs of people who've not caught COVID because we've had smart policies on the books. At this point, we think it's important that people understand how very serious this moment is, and that's why Dr. J went through the numbers. That's why Tina Fries-Decker went through what's happening and they're seeing in our hospitals. That's why it's incumbent on us to remind people no one is free from getting this virus unless you've gotten that vaccine. So get the vaccine. And if you haven't yet, make your appointment. And for everyone, until we get to over 70% of our population vaccinated, we got to continue to mask up and wash our hands. I am grateful for a lot of the work that the Biden administration has done. As I said, since taking office, we have seen incredible improvement in terms of vaccines and having the ability to know what is on the horizon and coming. We're continuing our conversations. They are sending a number of things to support us, whether it's the therapeutics or it is mobile testing and vaccination ability or boots on the ground. But we are going to continue to fight for additional vaccines. That is not a policy that they have embraced at this juncture, but I'm going to continue to fight for our state. I'm always going to do that. I believe that a surge strategy is prudent, equitable, and important, and that's the case that I'm making to the head of the COVID response team and the administration.
Our next question will come from Jonathan Coe with HuffPo.
Hi, thanks for taking this call. One question I have, this goes a bit of a follow-up. The request to the Biden administration is to surge vaccines from to hotspots, basically, which would mean taking it from places that don't have hotspots. And I'm wondering, are you doing anything inside the state of Michigan to surge vaccines to hotspots, since there are some parts of the state that are have much heavier caseloads than others? And if not, why not?
Yeah, we have done some of that. The problem is when you look at the map, the whole state is a hot spot. And that's precisely why we're making the case that we should have a surge strategy as a nation. I think that that's really important. So we are allocating based on need within the parameters of the vaccines that we have. We're moving quickly. 5 million shots in arms. We're one of the states that's been able to move the fastest. We've met all of our benchmarks, and it's an incredible network of providers that we're working with. And I mean, one of the things that I think has been so impressive, whether you go to Ford Field or you go to DeVos Place or you're at a local public health vaccine center, the work is happening and we are making great progress. We just need more vaccines because we are a state that has a lot of variants, and we've got a big part of our population that never got COVID in the first place because of the protocols that we've had in place, and that's precisely why this is a unique moment. We need some additional assistance here, and that's the case that we're going to continue to make, and as we are working tirelessly to get everyone vaccinated and encouraging people to make their appointments to get vaccinated.
We'll turn it over to Zeke Miller with the APX.
Thank you, Governor, and thank you for taking the question. We understand that you spoke last night with President Biden. Did you convey the request for the surge directly to him? And what was, can you characterize the nature of his response to you and his involvement in the planning of your state's response to this latest surge? And then secondly, can you confirm whether Michigan has in fact ordered 100% of all the doses allocated to it by the federal government, or has it been a lower than 100% metric?
So, yes, I did speak with the president last night, and we have spoken with a lot of people on the COVID response team and various agencies of the administration. As always, it was a good conversation, and they've offered up a number of ways to assist our efforts, and we are very appreciative of that. Let me start with that. I made the case for a surge strategy. At this point, that's not being deployed, but I am not giving up. I think it's really important that we continue to do so because, as I said in my comments, today it's Michigan and the Midwest. Tomorrow it could be another section of our country. And I really believe that the most important thing we can do is put our efforts into squelching where the hot spots are. I think it's about equity, it's about strategy, and I think it's the right thing to do. I've talked to a number of my colleagues, a lot of my fellow governors. They're very worried about what they're seeing in their numbers. Michigan often has been on the front end of these surges, and that could be the case here, and that's why it's so important that we surge vaccines into hotspots, and I'll continue fighting for that.
We'll turn it over to Rachel Just with WWIP.
Hello. Hi, this is Mike.
Hi, Rachel. Can you unmute yourself?
I'm having a hard time hearing you. And you know what? I didn't answer the second part of that last question. I'm going to ask Dr. J, too, about our ordering of vaccines. So, Dr. J.
Yeah, so the state of Michigan, we do allocate and order down all of the vaccines that are accessible to us. We actually met with the White House team yesterday and walked through our entire ordering strategy and when we ordered what and when. So it is very clear, and they agreed with us, that we are ordering all of the vaccines that are available to us.
Okay, let's see if we can get you now.
Rachel, for the next question.
Yeah, thank you for taking my question, Governor. Hope you're doing well today. I wanted to ask, I know that Let Them Play Michigan has been pushing to get rid of testing and quarantining for students. Do you think now is the time to have that happen? Do you think now is a time to trust them with that? Or another question I have for you as well is, can you confirm and can you respond to reports we're seeing that ICE sent hundreds of migrant children to be housed at a youth home in Albion?
I'll follow up with you on the second part of that question. We'll have to do that after the press conference. I'll have my team follow up with you on that. With regard to kids' sports, we know that this is a significant factor of spread that we are seeing. We know that, and it's an ongoing concern of ours. I know that there is a very vocal group that is fighting to ensure that kids can play. I get that. I support it in concept, but the fact of this virus is that is where we're seeing a lot of spread. And if you look at the national map, Michigan currently is a place where we've got COVID that is a real concern in all across our state, in every community. So I do not think changing or loosening things around protocols that we have put in place to keep kids safe is a good idea at this juncture. I don't know if Dr. J, you've got anything you want to add? Okay.
Thank you, Governor. The next question will come from Mitch Smith.
Hey, Governor, thanks for taking my question. Two parts for you. One, Michigan's roughly in the middle of the pack nationally right now in administering the doses it receives from the federal government. I'm curious how a surge strategy would fit into that, whether there's a plan to speed up the administration of the doses that have been delivered. The second is there a threshold for case numbers or hospitalization numbers or any other kind of metric at which you would go to mandates for the steps you're recommending today or other tighter restrictions as opposed to suggestions for people?
So I'm going to ask Dr. J to answer the first part of your question.
So absolutely, again, also on our call with the White House team yesterday, we went through all of our allocations. We went through how much we might have in inventory. The majority of those doses are actually scheduled or they're already in arms. So if you look at our allocation, if you look on a Tuesday or Wednesday, for example, that's the day when a lot of providers actually receive their vaccine. So yes, it is going to look like it's in inventory, but we are doing quite well with getting those shots in arms, as we've asked all of our providers, within 7 days. The expectation is not that at any given time someone would have zero inventory, because it's just much more complex than that, but we are absolutely we're surging vaccines to places like DeVos Center where they can get up to 30,000 doses in arms. So we're making sure that we're giving vaccines to those who can move quickly. We also have to be mindful that we have to address those high SVI areas where you may work with a neighborhood center or a church, for example, where perhaps you can't do as many vaccines, but we are absolutely getting shots in arms as quickly as we can. We're meeting with our hospital providers and our local health departments and certainly emphasizing speed. And we are doing quite well in the state.
And then back to the last part of your question about, are there things that we're seeing that might inform a decision to make additional changes in our protocols? I know I've said this many times over the last year. We're going to obviously work with our health systems like Spectrum to make sure that we know what's happening with regard to hospitalizations. We know that right now we are seeing hospitalizations up. It's a younger group of people. The mortality rates are lower. I'm certainly not minimizing the seriousness of this, but I think that that's part of the contextual piece that goes into where we're at and what the protocols are and why we have to put the foot on the gas to get the state vaccinated and implore people in the interim to do their part by masking up. So as always, those are the metrics: the positivity rate, the hospitalizations, mortality rates, and context. And vaccine dissemination is a big part of that context. We're at 5 million shots now, which is incredible. We are moving swiftly. We are actually, depending on which metric you look like, and that's why we don't look at the national rankings because they change every day practically, but we are in the top states in terms of getting vaccinations in arms, especially for bigger states like Michigan. So we got to keep doing that.
The last question will come from Eric Lloyd on 9 and 10.
Good morning, Governor. Since it seems like policy is not going to get us out of this, you say vaccines are. At our current pace, what is the timeline where we're going to start seeing the vaccines take a chunk out of these rising cases and getting closer to that 70% mark the state wants to hit?
So I think at an upcoming press avail, we will bring in a lot of the people that have really been helping us with our logistics and numbers. And we're really grateful for the help from Dow in particular, who has been a partner in this. We would anticipate that if vaccines come as we currently expect them to, meaning there's no glitches. And just this week we saw there was a glitch with J&J, and it's we're getting fewer J&J than we expected. There was a snowstorm a few weeks ago that was a setback. So assuming there are no setbacks and everything goes as we are led to believe that it will go, and we don't have any lulls in terms of demand, which is another big if, we could theoretically, by the middle of May, be to a place where we're at 70%. Now, how likely is that? Probably not highly likely, because there are high probabilities something will be a glitch, or we will have to do more work to earn the confidence of the public to get more people to be interested in getting vaccinated. But at this juncture, if all of those things happen well in advance of, or at least by the 4th of July, we could hit that 70% number. And that would be incredibly helpful for all of us in the state and good for our economy if we were able to hit that number. And that's why we're really encouraging people to go and make your vaccination appointment. Help your loved ones who are struggling to get an appointment, or a neighbor who hasn't yet gotten a vaccine. I spoke with a man yesterday who the health system near him called him and said, we've got some appointments, and he had already obtained one through Meyer. And so he actually went next door and asked his neighbor and his wife went and got it. This is the kind of thing that can really help us get to that goal that I know we all share. We may not see eye to eye on every issue in this moment, but I hope and believe that we all want that normalcy, and that's how we get it. Thank you, everybody. Have a great day.